capacity in our communities through this speaker series. I'm a public health nurse myself and working in the built environment portfolio, so my work aims to improve community health and well-being, prevent transportation-related injuries, and reduce health inequities in our communities. So this Transportation Equity and Justice series, it does provide a space for sharing experience, knowledge, and discussing how equity and justice issues and considerations are addressed in transportation. On behalf of CIFAL York, we hope you enjoy this session, and we invite you to engage during the Q&A to add to the discussion and continue the discussion as we move forward today. Thanks so much.
Thank you so much, Tia. And now I would like to introduce Sonia Sanita, who is a health built environment specialist with York Region Public Health. As a public health practitioner, Sonia is focusing on addressing how the built environment can improve health and well-being across all age and abilities. And in doing so, Sonia is partnering with academia to develop educational opportunities for training on health and development. Sonia has kindly accepted to be moderating today's session. Welcome, Sonia, and over to you to start off the session, please.
Thank you. Hello, welcome to session 5. Thank you very much, Shireen, for the introduction. I'm Sonia Sanita, Healthy Built Environment Specialist with York Region Public Health, and I'm very happy to be partnering with CIFAL York on this speaker series and honored to moderate this session. It is with great pleasure and gratitude to introduce our several speakers today. We have speaking Charles T. Brown, founder and CEO of Equitable Cities, LLC, Carla Mays, co-founder and head of global research with SmartCohort, and also David Capelli, co-founder and head of global partnerships with SmartCohort. So we will begin our presentation with Charles T. Brown, and then we will move into our second presentation, presented by Carla Mays and David Capelli. Thank you very much to all of the presenters for agreeing to be part of this very, very important session 5. I'll just introduce Charles. So Charles is the founder and managing principal of Equitable Cities, LLC, a nationally known urban planning policy and research firm working at the intersection of transportation, health, and equity. He currently serves as an adjunct professor at the Edward J. Blaustein School of Planning and Public Policy at Rutgers, the State University of New Jersey, as a senior fellow with New Urban Mobility Alliance. Charles is an award-winning expert in active transportation and micromobility planning and policy. In addition to focusing on the need to increase minority and low-income populations' access to bicycle and pedestrian infrastructure, he has helped shape the national conversation pre- and post-death of George Floyd around understanding the impact that over-policing, police harassment, and citizen intimidation via anti-Black racism has on Black, Indigenous, and other people of color in the US. He has a groundbreaking theory of arrested development, which asserts that Black people and other minorities have been historically and presently denied the legal and illegal authority, the alienable right to move, to be moved, or to simply exist in public space, resulting in adverse social, political, economic, and health effects that are widespread and intergenerational. Thank you very much, Charles. I turn it over to you.
Thank you so much for that wonderful introduction. Hello, everyone. Again, my name is Charles T. Brown, and it is a pleasure to be here with you today to discuss arrested mobility, exploring the adverse impacts of discriminatory enforcement on Black mobility. Before I start, I would like to let you know that I identify as a street-level researcher and as a pracademic, given my unique experience of working inside and outside of academia for over a decade. In terms of where I'm from, I was reared in rural Mississippi in a town of less than 500 people. But since that time, I've been very fortunate and blessed to have traveled and worked in communities of all sizes, all ideologies and cultures across North America. Politically, some of those communities identify as blue, some red, some green, but many confused. I live by the African proverb, I am because we are. And to kick this presentation off, I think it's important to start with my definitions or how I see equity and its importance in this conversation. Equity is the guarantee of fair treatment, access, opportunity, and advancement, while at the same time striving to identify and eliminate barriers that have prevented the full participation of some groups. It's important to remember, though, that the principle of equity acknowledges that there are historically underserved, under-resourced, and underrepresented populations, and that the fairness regarding these unbalanced conditions is needed and continues to be needed to assist equality in the provision of effective opportunities to all groups. And so then what we know in its most basic form is that equity simply involves trying to understand and give people what they need to enjoy full, healthy lives. But when you dig deeper, and when you move from equity being just a lens that you put on or a desktop exercise, you quickly understand that equity is the presence of justice and fairness within the procedures, the processes, and the distribution of resources by institutions or systems. See, facing this equity work requires an understanding of the underlying or root causes of inequalities and oppression within our society, which takes us to the importance of racial equity. Racial equity is about transforming the behaviors, the systems and institutions that disproportionately harm people of color. It is about increasing access to power, redistributing and providing additional resources, and then lastly, eliminating those barriers that we speak about in order to allow people to live their full, healthy lives. But racial equity is not about excluding other marginalized groups. In fact, we understand that equity impacts intercept and compound with other identities such as gender, sexual orientation, ability, and etc. So today, when you hear me speak about racial equity and particularly arrested mobility in the context of how it's impacting adversely Black populations, understand that that is not excluding other marginalized and oppressed groups. So what is the current context? Well, currently there are a plethora of federal, state, and local initiatives, plans, policies, and programs in North America aimed at increasing physical activity and improving pedestrian and bicycle safety and mobility among Black people in the US. Now, these great programs include Vision Zero, Complete Streets, Open Streets, Livable Streets, and even Safe Streets. However, when you look at them in a very objective way, what you quickly see is that few, if any, ever actually achieve their goal of removing barriers to being more physically Black for Black people, being more physically active for Black people, I meant. So what then are some of the challenges or the opportunities or the shortcomings of these programs? What we find is that the current descriptions are often ahistorical or apolitical, particularly in regards to the history of systemic institutional racism in the US. Secondly, what we find is that the strategies do not highlight to the degree that they should the role of state and municipal law enforcement in discouraging and denying physical activity among Black people and other people of color. Thirdly, equitable and inclusive access is listed as foundational elements, but not explicitly as a desired outcome or goal with any tangible organizational commitments to funding organizations that work with and in these communities. And then fourthly, what we find is that there's no mention of the overwhelming data highlighting the magnitude of unconscious bias and the criminalization of Blackness or otherness in America. And then lastly, what we find is that these strategies, of course, mention DEI, but not to the extent that it should internally as well as externally. So what we find is that particularly in public health, there's a lot of discussions about these being social determinants of health. But what we really know is that these, just like many others, are political determinants of health. And to illustrate that point, I want you to know our, as in Black people's, mobility has been arrested. What is arrested mobility? Arrested mobility is an assertion by me that Black people and other minorities have been historically and presently denied by both legal and illegal authority the inalienable right to move, to be moved, or to simply exist in public space. This unfortunately results in adverse social, political, economic, and health effects that are widespread, preventable, and intergenerational. Which takes us to racism and arrested mobility and the framework around it. You may ask, is there a framework for arrested mobility? As shown here, arrested mobility is a direct manifestation of racism across 4 distinct realms of racism: the personal, the interpersonal, the institutional, and the cultural realm. These collective realms of racism have resulted in the social construct of race, both locally and globally, and have led to the intentional and deliberate targeting, of Black and other minorities in the US. And when it comes to this targeting, this includes their physical mobility first, of which there's a direct relationship, and secondly, more indirectly, the social mobility. And please understand that I understand that the direct relationships shown here between these variables are much more complex and nuanced than displayed. So then the question becomes, how are Black people over-policed? Well, it starts with the ways in which you define policing. In the arrested mobility framework, we radically redefine policing to include what we feel are the 3 big P's. One is policing or law enforcement. The other is policy/planning, that being urban planning. And then thirdly, it is polity, which is the self-deputization of non-Black citizens in North America. And when you look at over-policing, it becomes more evidence across these 3 forms: the policy, the polity, and the policing. And in the context of physical mobility, it is most evident when you look at people, how they move or operate in a space. I mean, whether they're walking, biking, driving, taking public or private transit, hopping a ride via rideshare, or using a micro-mobility device such as a scooter. And so you may ask at this point, is there indeed evidence to support arrested mobility across these different modes that I mentioned? Well, let's start with walking. In the US, some of the most notable cases of arrested mobility included the deaths of Ahmaud Arbery, Trayvon Martin, and Mike Brown. But the question is, what does the data say? Well, when you look at an analysis of 5 years of tickets issued to pedestrians in Jacksonville, Florida, it revealed that 55% of those tickets were issued to Black individuals, even though only 29% of the population identifies Black. In fact, Blacks were 3 times more likely to receive a ticket than whites, and residents in that same city's zip code, 3 poor zip codes, were about 6 times as likely to receive a pedestrian citation. And if you have not heard of her, Raquel Nelson, please do yourselves a favor and quickly Google what happened to this Black single mother and college student. Which takes us to the next mode, biking. Now, there are a plethora of studies out there that talk about the over-policing of Black mobility via biking in this country. I've authored a number of these studies, but some of the more recent ones include Biking While Black in Chicago, which was done by the Chicago Tribune. Interestingly, what they found in that study is not a single majority white area ranked in the top 10 for bicycle tickets, despite biking's popularity in white areas of that city. But what does the data say on a national level? Well, what we know is starting in the Southeast between 2003 and 2015 in Tampa, Florida, the police there issued over 10,000 bicycle tickets. 79% of those tickets went to Blacks, even though they only make up 26% of Tampa's population. In fact, during that 12-year period, at least 142 bicycle tickets were issued to kids aged 15 and under, including children as young as 3 years old. In Oakland, California, heading out west, 60% of all bicycle stops included Black cyclists, even though the population is only about 25%. Then bringing it back to Chicago and the Midwest, what we find is that if you're Black, you're twice as many, in Chicago, twice as many bicycle citations are written in majority Black neighborhoods than in majority white or Latino neighborhoods. And in one case, it was 321 tickets issued in a primarily Black area versus only 5 in a wealthy majority white area. But arrested mobility, as I stated early on, don't just end with biking or walking. It also happens in driving. And some of the most recent cases of that includes the murder and death of Philando Castile and Sandra Bland. But what does the data say nationally while driving? Well, what we know is that a nationwide quantitative analysis of policing trends and traffic stops show that Black and Hispanic drivers are stopped disproportionately to white drivers, even though the hit rate of them are similar. And what we found unsurprisingly is that police are less likely to pull over Black drivers after dusk when the race of the driver is less obvious. This takes us back to the Midwest, where the state of Minnesota, in particular Minneapolis, has been in the forefront around discriminatory enforcement. There, a state commission study found that Blacks and Latinos were 7 times more likely to be stopped by police in white majority neighborhoods. In fact, in 2016, 47% of the arrests by the St. Anthony Police Department were Black individuals, even though the patrol area is only about 7% Black. But it doesn't end at driving neither, which takes us to public transit. And one of the more noticeable cases there included the death of Oscar Grant III, who was a 22-year-old Black man murdered by BART police officers in Oakland, California. But the data around public transit tells a similar story. See, a Marshall Project analysis of New York Division of Criminal Justice Service data from 2014 showed that while the number of turnstile arrests have decreased significantly, what has not changed is who gets arrested. 89% of those arrested are Black or Hispanic. In fact, the top 10 neighborhoods in New York with the highest numbers of arrests per subway swipe were all predominantly Black or Hispanic. If you haven't Googled Adrian Napier, please do me a favor and Google him quickly. Thankfully, in 2017 in Portland, their policy around fare evasion was later decriminalized, but in 2017, Blacks were 8 times more likely than whites to be charged for certain transit violations. But arrested mobility doesn't end at public transit. It also is included in ride sharing as well. And what we find there by way of data is that Black travelers waited on average 20% longer than whites to have their ride accepted. And in fact, when it comes to the intersectionality piece of this, female travelers were driven 5% further than males, given the same start and finish location. And if you're a Black or African-American and have experienced this, I know I have, 55% of Blacks who call for a cab at some point have experienced a refusal by the service to send a cab to their community. But that doesn't end arrested mobility. It also continues whether one is a home sleep in their home, such as Breonna Taylor, or being a child playing outside, such as Tamir Rice. But what then are the adverse social, political, economic, environmental, and health outcomes of arrested mobility? Well, really quickly, what we know is Blacks are less likely to be physically active than whites, regardless of their neighborhood or individual income levels, poor versus non-poor. Areas with larger Black populations tend to have lower rates of upward mobility. That speaks to the connection I mentioned between your physical mobility and your upward mobility. They're disproportionately associated with food deserts, which are made even worse by a lack of transportation options. And then lastly, there's the segregation, which discernibly affects educational attainment for Blacks, which also impacts their upward mobility opportunities. Then lastly, what we find is that they're less likely to have access to healthcare, supermarkets, education, and jobs. And then there's the political piece where this leads to disenfranchisement efforts like a lower density of polling places. So what can we do about it? What can you do about it? Well, here are a number of things in the context of equity that you can do. I'll touch on the importance of racial, modal, procedural, language, gender, and spatial equity, and then also touch on some common sense things. So I'll breeze through these really quickly for the sake of time, but here are about 12 to 13 actions that you can do right now to hopefully center racial equity in the work that you're doing. Number one, commit to equity through the adoption of a racial equity action plan, regardless as to whichever institution or organization that you are part of. Make that your number one action. Action number two, prioritize investments in maintenance in Black, Brown, and low-income communities. And don't just build the pedestrian and the bicycle infrastructure. Please be sure to maintain it as well. In fact, I argue that we need a reparations style infrastructure package for these communities, which will include bicycle infrastructure, pedestrian infrastructure, and even investments in public transit and public art. No matter what that investment is, however, it shall include maintenance. Action number three, ensure the full and the fair participation of racialized minority groups. Too often in our processes around transportation enhancements, investments, and other outreach and engagement efforts, outreach and engagement is simply a formality instead of valuing and giving rise and attention to the voice and concerns of the oppressed groups in your given society. Action four, foster more equitable treatment of diverse languages in the public sphere. We all live in places that are extremely diverse. Let's be more cognizant of that, but let's act to ensure that there is language equity and access. Number five is around addressing issues associated with the elderly and persons with disabilities. What we need there is to document and increase mobility and access for them, but we also need to do that for women as well as for foreign-born populations so that we can deepen our understanding of these behavior and usage differences, which takes us to action 8. If you're going to build it, if you're going to maintain it, be prepared to evaluate and mitigate the unintended consequences of improved mobility and access. Because as we often say in the Black barbershop, trees planted in minority communities mature just in time for gentrification to take place, which takes us to action number 9, addressing or analyzing the impact of past and current zoning and land use decisions. If you believe in structural racism, many argue that zoning and land use practices was one of its first and best tools. Action 10, safeguard against discriminatory enforcement. That is all of our business. Action 11, it's imperative that you challenge and eliminate the scary Black male narrative. And while you're at it, challenge and eliminate the angry Black female narrative as well, which takes us to action 12. We need more data on Black lives and experiences, so please do your due diligence to collect and analyze this data, but ensure that it is disaggregated so you're not normalizing the experiences of Black and Brown folk, which takes us to action 13. Advocate for the penalization of race-based 911 calls. Given the Ahmaud Arbery's and others, do I need to explain that? Which takes us to action 14, jaywalking. Please organize efforts to decriminalize jaywalking across this country. It is being used in a pretextual way to target and oppress many brown, Black, and low-income people who are simply trying to get to and from their destinations. And then lastly, organize efforts to decriminalize biking as well. There is no need for people to be in prison, to be fined to the degree that they have for minor things such as riding on sidewalks or not having proper lights or reflectors, given that every car that is sold has to be in compliance with the law. Why do we allow bicycles to be sold that are not in compliance with the law? And so at this point, many of you are saying, we get it, Charles or Charlie Brown, we're in the same boat. No, we're not in the same boat. We're in the same storm. And that is a huge, huge difference. See, when I go around in Black and brown communities, I quickly learn that they are tired. They can't go jogging. They can't walk from the corner store. They can't come home with Skittles, get a normal traffic ticket, break down on the road with car problems, have a disabled vehicle. They can't run. They can't breathe. They can't live. They know, like I know, whether they're a senior or a person on a bike, if they're Black, their mobility has been arrested. Thank you so much for your time. It's been a pleasure being here with you today.
Thank you so much, Charles, for such an engaging and insightful presentation. You have shared such important research that provides a critical lens for public health, transportation, engineering, and planning practitioners to consider in our work. Your action items specifically are extremely meaningful and insightful, and will certainly help inform our work as we go forward. If anyone has any questions, please feel free to type them into the Q&A, and we'll go through them at the end of the presentation. Now moving to our next speakers, Carla Mays and David Capelli. Carla Mays has 12 years of experience serving as a senior advisor to many US and international leaders in public and private sector agencies and companies on designing equitable digital and disaster strategy, planning, research, and analysis in times of crisis, recovery, and closing digital and transportation divides. She has been leading academic longitudinal SMART studies and transportation equity field research in Singapore, Hawaiian Islands, United States, Switzerland, Germany, and Austria with SmartCohort, and presenting research and workshops to international audiences on digital and transportation equity in public sector integration. David Capelli is an applied researcher, facilitator, and curator, co-founder and policy chairman who thrives on cross-sector, cross-silos, and international bilateral collaborations and partnerships to advance equity in transportation infrastructure. After discovering major governance and finance gaps to implementing winning government technology solutions, in 2016, Capelli co-founded SmartCohort to enable an equitable, smart, and disaster-resilient world through applied research, curated programming, and knowledge exchanges to address systemic infrastructure governance and finance challenges. Applied research fieldwork has included Hawaiian Islands, Singapore, Miami-Dade, Puerto Rico, California, Canada, Wisconsin, Washington, D.C., and London. Capelli served as an inaugural board member for the Miami-Dade County Millennial Board and completed his term as chairman in 2020 by delivering a 30-plus recommendation report focused on equity for the millennial demographic. He was a 2018 Global Climate Action Summit delegate in San Francisco and is a current World Economic Forum Global Shaper in Palo Alto Hub, where he led a national team of shapers on co-creating the US COVID-19 recommendations report for an inclusive recovery. Welcome and thanks to each of you, and I will turn it over to you.
Thank you so much. So thank you so much for this opportunity to present today. So can you see my screen? Wonderful. So thank you for the opportunity. I'm, again, David Capelli, co-founder and director of global partnerships at SmartCohort, and I'll be co-presenting with my co-founder, Carla Mays, our head of global research at SmartCohort. Today, we'll be discussing transportation equity, disease, crime, and violence. So we've co-founders of SmartCohort. Our mission is to drive governance, finance, and technology implementation research for next generation leaders in times of crisis, for digital and physical infrastructure and development of smart cities and regions. We ground our work in the UN Sustainable Development Goals with a specific focus on 7 through 11, 13, 16, and 17. So at SmartCohort, we do original academic and field research in international, equitable, resilient recovery best practices. Some of our work has been with the American Society for Public Administration, American Society for Civil Engineers, American Planning Association, the Institute of Transportation Engineers, Congress for New Urbanism, International Society of City and Regional Planners, Urban Futures, etc. We produce virtual programs, international design studios, symposiums, and tours. We thrive on international collaboration, partnerships, diplomacy, and civil society. And we're meeting the pandemic and recurring climate and extreme weather challenges through virtual programs, advising, and mentorship. So Carla leads our global research. She's just finished Urban Land Institute Pathways to Inclusion Fellowship in San Francisco and was part of the San Francisco Clean Energy Leadership Institute Fellow, and has her master's and bachelor's of public administration from San Francisco State, is a graduate of Berkeley Haas, and is postgraduate in work in emergency management from Cal State Long Beach. The moderator provided my introduction, but together we've completed the London School of Economics, Harvard University Graduate School of Design program in future cities, as well as being co-delegates to the Global Climate Action Summit. And that's us writing the MRT in Singapore in January 2020, right as the pandemic was beginning. So some of the research methods that we use in our work are qualitative field work. So we ground truth everywhere that we go on transportation equity, different news and social media articles, literature reviews of journals, professional associations, and peer-reviewed articles, as well as attending conferences, symposiums, lectures, community meetings, and agency programs and government listening sessions, etc. Some of our field research in Canada has spanned from Montreal to Toronto to Victoria, from the Next City Vanguard program to being with Mayor Helps in Victoria, to District 3 in Montreal, and the Intelligence City Summit in Toronto. So here's some of the photos here. So for today's discussion, how we're going to ground this is we're going to discuss current notions and assumptions of transportation equity. Then we're going to discuss the realities of what's going on with the current disease and violence in public transportation. Then we'll discuss advancements of driverless and autonomous vehicles throughout the pandemic. And then lastly, public sector equity recommendations. So some common assumptions in planning is the European ideal, or the idea of looking at Europe for our models, right? Then understanding and looking at democracy and freedom, the idea of car-free, so the overemphasis on car-free literature and discussions, and then walking and biking as what we look at as ideal in the planning sector. So a lot of our focus at SmartCohort is on Asia. The public perception of public transportation, and then the realities that we saw before COVID, is that public transportation is dangerous, frequency challenges, filthy, customer service challenges, that it's a hostile environment for BIPOC and/or low to moderate income riders, LMI. It's expensive, and it favors choice ridership versus essential riders and workers. And then digital equity issues with payment and ticketing. And then lastly, accessibility. So equity by design and afterthought and narrative and story. Carla will lead into these slides and continue from there.
Greetings and thank you so much. I join you from San Francisco, the land of the Ramatash Ohlone Native Americans. And so very excited to be with you. And I want to continue where Professor Brown left off, because I think that he said a very good, he's told you exactly, where we are. And I'm going to try to do justice to picking up that conversation. There's a lot of assumptions when it comes to like where David laid out the narrative of, walking, biking, car free. But these things, are more of an afterthought because they haven't been well thought out, because there's not a lot of representation in this field of planning to begin with. And so the narrative and the lens that is looked at this doesn't necessarily always, be able to provide the whole story. Therefore, we don't have a good way of implementing. During COVID, and, we really started to look at what were those elements that were things that we had been seeing for probably the last 15 years. In looking at policy. So really moving towards car-free, less parking, slow streets, these were things that got enacted, and really looking at biking and rideshare scooters. But the biking, when it came to using the streets was not, the infrastructure wasn't in place. And then if bikes or things were provided by municipalities, they were not, necessarily available digitally, looking at digital access as well as credit card access and coming in, into being where they were first thought of as people with disabilities and so on. And so with that being not thought of, the issues, we started to have challenges. Next slide, David. Sorry, I forgot I'm not clicking the slides. So pre-COVID, we had a lot of challenges with equity and JEDI, meaning that we didn't have a lot of representation in planning around these things. We didn't have a lot of community engagement. Things aren't, designed, universally designed. There wasn't a lot of route access issues, the routes and connectivity of planning is not good. And then the first and last mile, which sometimes is like 15 miles away from a transit station, and the frequency caters to, folks that are digitally and mobile, that are digitally connected. Have credit cards and that, commute, to high-end suburbs from, downtown locations. And so these were the things that we're really focused, we're focused on in planning for, talking about trying to get to that European ideal. And the challenges of racial profiling, fare evasion and things have been quite grave. Including here in San Francisco, BART taking on the idea of having razor gates at the transit turnstiles to deal with fare evasion. So these kind of situations only got more grave as COVID went on. Next slide, David. So again, we've during COVID, we've gotten, these things have kind of gone forward even more so in North America. More looking at, VMT and congestion pricing, less parking, more slow streets and closed streets without regard to how people actually get around and what their challenges were during COVID, access to essential services. Looking at these things and having a narrative that didn't quite fit with where folks really have what their real challenges are, and more more emphasis on touch-free and digital platforms, mobile phones, smartphones, technologies, and other types of things, looking at fares, and sometimes they suspended them to be able to buy more technology, to be able to take on doing their digital transformation through different types of pandemic funds. So the question, begs the question, is this more equitable in the way we're going if we, have not corrected the problems that, that we're having, and that we're not looking at equity first or equity by design. Next slide, Davis. So we've kind of gone over this and we looked at these things as more, they're being regressive. There's more anti-car, but we really haven't really looked at, deeper. What are the frameworks? What are the implementation strategies? What are public sector roles in this? And then, what is, where's the data? Do we have data gaps when it comes to equity around our implementation strategies and the like? A lot of our work at SmartCohort is really, really picking this apart. So one of the things that we've been looking at is the closed street phenomena and looking at tactical urbanism. And what we found was this is what, we're being told, right, in planning, that this is great, more biking and walking and things. And some of these pictures are from downtown Oakland. But at night, next slide, David, this is how this really plays out. We're having the phenomena of sideshows and street takeovers. because the fact is that these communities are not being included in, in being able to really enjoy these type of things. And then the inequities that stem from them create a situation that is actually flip. Next slide, David. So right away in COVID, we went from a situation where we had all these challenges that I spoke of, and then we stopped service. We adapted programs for choice riders like slow streets and things of that nature that then disenfranchised folks even further, keeping them away from essential services and the like. We started to have a lot of issues with staffing and folks and operators having illness and death, slow to respond to addressing these issues. Increased violence, and the changing protocols are making folks dizzy. So one time, a couple of weeks up, we go into wearing masks. A couple of weeks we take the mask off. There's shutdowns, there's route changes, there's staffing changes. It's just a really dizzying time that really that folks really are not able to get their lives back, and it's causing the mental health anxieties and the stressors, and then the fact that we're not consistent on anything really drives a lot of the anxiety. Next slide, David. So the challenges are felt deep. Lots of folks have passed away due to COVID-19. Lots of folks that work for transit agencies don't have any job stability. There's not really anything to protect them from COVID. The up and down pendulums that we have a vaccine, but the vaccine doesn't stop you from getting COVID. A lot of our transit operators and transit folks are suffering from long haul COVID, which is something that is growing, which we don't talk about a lot, and there's really has been no real addressing of these phenomena by transit agencies or by government. And so these are really the challenges, and a lot of the folks that we're seeing at the driver level are BIPOC or low to moderate income people, drivers and essential workers that have really had the brunt of COVID. Next slide. We're seeing more violence and crime, towards, not only Asian populations, but towards everyone. Folks are really dealing with this, and and you're seeing it from the up and down, with the protocols and regulations to, folks not being able to get back on their feet. And it's really, folks are feeling pretty desperate, and that is coming out how that's showing up is all of the different crimes and things, and the fact that we're not able to deal with that in any kind of way, particularly here in the United States, is a real challenge. Next slide. So, like and then here recently, we know what the things are, the protocols that keep COVID at bay, which is masking, cleaning protocols and distancing. But here in the last couple of months, we've just forgotten all of that. For the most part, there's things of talking about these things, but they're not practiced regularly, which really, for BIPOC and low to moderate income and those folks that are immunocompromised has really, limited their mobility. And it just seems like we're just kind of going along with it and understanding. We've kind of made this idea that this virus is over, COVID is over. We're into, we're going into that this is going to be with us, and this is just the way this goes. The challenge is, next slide, David, that it's not. And our essential workers and folks are, pretty much left on their own. So in this picture, you see people who are able to get a mask. They'll wear it, but when the viral load is this high in this kind of a setting, it's very hard not, especially with like the blue mask seen by the gentleman who in the red shirt. That mask is only good for about an hour, and definitely not under these kind of conditions where everyone is mostly unmasked. There's one man wearing an N95 in the back of the bus, but still there's a lot of viral load around him, and there's not a lot of handing out of N95 masks that are available. And on public transport, these are challenges. The issues that we're dealing with right now are individualism. There's not a lot about the collective in trying to put this virus at bay. Acknowledgement that this pandemic is still happening, the changing in the protocols that they make folks that is back and forth, and there's nothing that is able to be stable. There's a politics over science, right? How we collect data. We know how COVID and the COVID protocols, but we failed to do that because of politics. There's lack of pandemic assistance, which is driving a lot of the scarcity. And the elimination of the protections make people not want to take transit. The challenge is, there's a lot of, I would say, neoliberal politics about like drugs and, legalization of drugs, but people have to buy drugs and they have to find money for it. And there's no help. So these things are driving the violence, the crime, and the disease spread, because we just don't, these things are these are some of the issues that we're challenged by. Next slide, David. So when we look at these things, it is pushing folks to drive more, and it's pushing folks to have to be thinking about driving, because they have to think about for themselves to protect disease. They can't really walk and bike for various reasons that that Professor Brown discussed. The crime and policing and the cost, these things are driving the disease. The reason why COVID goes up and down, and the severity in which we see it. The challenges of really being in cities that are more neoliberal, that they're really kind of like this COVID thing's behind us, and we're not really looking at where things are going. And those of us in planning are pretty dogmatic on how we see things without dealing with our equity challenges. Next slide. So one of the things that has been able to things have been advancing during COVID, and very quickly. Driverless everything has been taking off. We've also seen a lot more of talking about tolling for freeways and things of that nature, and transit cards and more digitization. Next slide, David. For this presentation, we're going to really focus in on the driverless component, because there's something that's very interesting about the driverless over some of these other solutions and what's been happening. But the challenge is that there isn't really, nobody's focusing on this area, and there's not really a lot of strategy, research, and policy, and definitely governance has been in a vacuum on them. Next slide, David. So robo-taxis are really taking off, and we're really starting to see the first driver's license for a robo-taxi was issued here in California just last week. And the idea of a robo-taxi is that it's similar to an Uber, having a ride-hailing service, but for a car that is driverless, and it's making a big impact. Notice that these pictures are women, particularly women of color, on these teams that are deploying the robo-taxis. We're seeing a lot more folks of color and researchers and technicians. So these cars are really taking off, but it's in a vacuum. And why I say this is that, you know, folks are really looking at a European model, but I would say that we really need to focus in on this because the cars, a lot of these cars are being manufactured in BIPOC areas like Detroit, and you know, and definitely in Asia, and we'll take a look at that. Next slide, David. So we said that, you know, I was saying that last week, you can now, you know, that they got issued their driver's license, and from 10 p.m. to 6 a.m. You can take a driverless taxi here in San Francisco. Next slide. So on-demand transit is starting to be really big and really, you know, it's starting to be really big, and a lot of folks are looking at this at transit agencies because of the fact that the drivers and the challenges that we're having, there's a driver shortage. So when we talk about demand responsive transport, this is where we're going. And this is what's been going on. In China, this is really big. You know, it's probably the hub of these kind of vehicles. They've got full on autonomous buses, not only the shuttles that we see. So here is a photo of there's an autonomous bus. It runs a route. You see folks are masked up. The bus, you know, is very clean. And it can, you know, it also can pick up folks with disabilities. So it automatically already comes with the wheelchair ramp. It can be talked to. So, you know, so someone who's blind or, you know, there's different interactions that the bus has to deal with people with disabilities and at all abilities, which is something to really learn from. So David and I were in Singapore. We got to ride one of these vehicles in Singapore, the Auto Rider, and it's been around for, you know, since 2015. Next slide, David. So the challenges that we have for this is that in North America, we constantly focus on issues of, you know, traffic, you know, that what are we going to do with these cars? It's kind of what if we're going to do with these cars. And as I told you, these cars are already on the road and they're already, you know, the barn, you know, the horse is out of the barn. But we are not really dealing with it in the fact that planners, folks at the policy level, they're having a different conversation about getting to some kind of ideal Europe when we're in this time where these cars are already on the road. China's, you know, been doing a lot of this research, and then they have a lot of deployments actually, you know, around North America, and we're just not partnering with them. And so the challenge with this is like making sure that this doesn't become a disruptive technology. And in a disruption where you have these cars, just, you know, the robo cars doing what they're doing, the regular cars, and then we focus so much of our attention towards something else that we didn't put the policies in place, so that we don't have the Uber and Lyft and other types of on ride hailing challenges, and that we do in fact implement these correctly, so that we're addressing our transit deserts and other types of challenges that we have with regular mobility. Next slide, David.
So some of the challenges and pain points in the pandemic are the dystopian effect we've discussed in Western cities. That smart cities, corporations, and the mobility space are spending most of their time educating municipalities and agencies versus implementation. And that in the West, smart cities is more of a marketing and failed concepts of implementation versus solving the resident and corporate needs like they do in Asia. We see an overrepresentation of European models of smart and sustainable cities infrastructure that are failing to address large multicultural metro regions that are dense and are implementing technology during the pandemic for future cities development and planning. In addition to this, we're not seeing the necessary research with Japan, Singapore, and China on demand response public transit, as well as autonomous vehicle technology and planning. We're not addressing minority majority cities and regions in North America for future cities development planning equitably. We're not addressing systemic inequities. We're still looking at European models versus understanding Asian models, of universal design for urban planning, for comprehensive smart cities planning and housing, transportation, and digitalization. So how are we at SmartCohort addressing this pandemic recovery? We've done several curated programs with governance and finance infrastructure leaders, really looking at this collaboration between the East and the West on the technology, as well as the governance, planning, and finance. Some of our recommendations are that we have to address research gap in transportation and public sector equity and equitable transportation implementation, and managing the disruption in technology of new mobility in these times of crisis. Transportation executives must take leadership roles in equitable implementation of new products and services, and that the diversity of the transportation executive matters. So locals, people with disabilities, BIPOC executives, veterans, women, et cetera, need to step into the C-suite. What do we mean by transportation equity? We mean that we're addressing this Western dystopia, the crime, disease, homeless, and violence, looking at federal, state, and local collaboration on funding, operations and maintenance, so looking at the long-term life cycle funding, and then addressing our anti-Asian bias and best practices in design and planning. Also means we're addressing digital equity, online, offline strategies for new technologies and transportation solutions, addressing transportation equity in the ITS and ITE, so transportation systems and transportation engineering. So meshing planning for equity by design with IT and ITS systems, and looking at good, sound public administration, looking at management versus a startup or private sector approach. Continued research in the field around this could look like driverless vehicle deployment policies and equity, future cities and autonomous vehicle planning, understanding international best practices and universal design for equitable AV planning, and then public administration management and budgeting for equitable transportation. So we know this is a lot today, but we look forward to collaborating further on an equitable pandemic recovery and look forward to your questions in the Q&A session. Thank you.
Thank you so much, David and Carla, for a wonderful presentation that touched on so many relevant topics. Thanks to each of you for educating us on such important work. And your research has really been eye-opening, and it will inform and transform many perspectives without a doubt. Now we will just move to questions. I see there are a couple in the Q&A. A question from Kim, presentation one for Charles. One of the actions notes included collection of data and importance of being able to disaggregate data. For areas that have not been collecting SES data, including race-based data, there is often discomfort or concern in collecting this type of information. What are some best practices you can share to address the discomfort while addressing the importance of data to address racial equity in programs and services?
There are many ways to address that question. I'll try to do so really quickly. First and foremost, if the discomfort is from the organizational side of things, I would say, please get out of your own ways and grow more comfortable with engaging people, regardless of their race, ethnicity, income, or status. If it's discomfort from the participant standpoint, I think you have to understand the history as to why one may be reluctant to share that information. So you then have to acknowledge that you represent an entity of which they may have some history with and some concern about. So acknowledge their reluctance and be okay with that. Secondly, I think there's an issue of being able to properly explain why race, ethnicity, and other data is important. So what one has to do is to orient themselves with that importance and share that with the participant so they can understand how it can influence research, even to their advantage by them fully showing up in that research. And then thirdly, some data is better than no data. So if you have to compromise, please do so, but do your best to still get the data that is needed so you could do this level of disaggregation. And if that doesn't work, I think it's important for some of us to look to other people to do that job instead of ourselves. It may not be that you're the best person for that level of data collection. Perhaps you need someone better oriented with that experience and more comfortable doing it if that doesn't work. So those are my thoughts.
Thank you very much, Charles. Kim and Carla and David, do you have any insights to share on that? If you'd like to add anything.
Yes, I think continuing where Professor Brown left off, the most important thing about these things is challenging assumptions. For too long, assumptions have been driving the way we do transportation equity research, right? We have an assumption that biking, walking, or the idea that some European ideal. And the problem is that, and then we look at, when we talk about China, it's always negative, right? Every time it's negative. It's, there's never a time, there's always a but or something like that. And the challenge is that we're going to have to get good with that. Our transportation in North America and in other places that follow more of a Western standard is, has been built on stolen land, built out by slaves or somebody who's enslaved to get there. Like, that's the premise. Like, as much as we want to, glorify how lovely it is to travel to these places and to sit around, this is the way it was built. When we look at the Robert Moses and and Justin Hermans and other people in planning, they really did a lot of harm. And so the challenge when we look at data, and I have to credit folks at McGill University, where I first heard this in 2016, we started talking about who collects data and why do we collect data. We already know the problem. It's not something like, we don't need data to prove the problem. Like, we know what the problem is. The challenge in this is actually just doing something about it from a management perspective. Hence why we said you have to have the right leadership. In Los Angeles, when you look at Stephanie Wiggins, who leads LA Metro, and her predecessor before that was, Phil Washington. These are leaders, and they're talking about equity, but they're also, their budgets reflect it, right? Their budgets, they have at LA Metro, they have an equity budget. And that's when you've put, in a capitalistic Western society, that's how we express our values. So when we do data audits or something, we look at a budget first, because then we see what we're spending our money on. We see if it's a longitudinal, if these things are like, if you're acquiring technology or you're acquiring something, that the life cycle, and this is also about sustainability, right? And resiliency. You have to have life cycle investments. And so you're looking at these data points. It's not, is there a failure? We already know that there's a failure. That's not how we can correct it. So I would say that really looking at budgets, starting to look at plans, look at leadership. Who is really leading in these areas? And then you have to have representative leadership. And then we can start to tackle something and we start to see progress.
Thank you very much for that response, Carla. Moving to our next question from Martin. Did U.S. public transportation agencies increase subsidies during COVID-19? In Ontario, subsidies increased before the election, but Toronto was treated inequitably. And there's a link there to a news article. So the question for all the speakers.
So I can answer that first. In the United States, there was substantial subsidy for public transportation agencies in the beginning of the pandemic through CARES Act 1 and CARES Act 2. It's been about a year, and there's been zero further subsidies for public transportation agencies. So as Carla highlighted in our presentation, in addition to the public transportation agencies not receiving funding in the last year to cover farebox recovery deficits and maintenance backlogs, we're seeing a staffing issue, and we're seeing a maintenance issue and routes being cut disproportionately in areas where essential workers rely on them. So yes, there was initial CARES Act funding, but there wasn't substantial funding to address the overarching problems that we've outlined in our presentation today for transportation. The Infrastructure Investment and Jobs Act was not covering transportation agency budget deficits or protections for workers. It was looking at new constructions of roads and the advancement of clean energy and electric vehicles. So yes, there was in the beginning of the pandemic, but in the last year, there has not been subsequent funding needed to provide the critical transportation services to the residents in need.
And I would argue a lot of that money has been spent on closed streets, parklets, other things. It was not spent to deal with the transit deserts, really figuring out how folks were going to get essential services or worker protection for folks that work for transit. The safety, the cleaning, the masking, the things that were necessary. So the challenges were that we started doing tactical urbanism with that money. And then we've been trying to maintain the tactical urbanism that we undertook during COVID versus fixing the inequities and the problems that has been, that basically are driving the disease to stay with us, stay with us longer and continue, continuing this cycle. So the challenge, like in the States, we have something called Justice 40, which is, trying to deal with this, but still it's built on trying to get to the European notion, the European ideal. It's not spent like, I would say right now, we really need to be spending a lot more time understanding Taiwan and places that are really highly dense that have been able to deal with COVID. And that are able to, they're doing a lot better with aging populations, folks with disabilities and the like. So in answering that question is that money was available, but it wasn't necessarily to deal with the challenges of the folks that were there that have been constantly having challenges because of institutionalized racism and inabilities. And then we've created these new structures that are even worse, like closed streets in some cases, like here in San Francisco, lead to Asian, lead to a lot of Asian hate crimes. And folks being left out, my neighbors can't get around, and if they're going the wrong way. And then the police, the idea of defund the police has taken a whole different route. It's not what Black communities and Latino communities and Asian communities would want. It's something that allows for legalization of drugs. That's why I put that in the presentation, because there's a lot of things that are deferred off to the neoliberal aspects of this, but not addressing the inequities in transportation access.
Thank you so much, Jude, for your response. That's it in the Q&A. I actually had a question that I'd like to pose. It's linked to some other items that were already discussed earlier on. What can be done to help stimulate governments to take a closer look at the cross-section of race and mobility? And I asked that like specifically in Canada. What are some suggestions, if you may? And I put the question in the chat as well.
Well, Professor Brown, do you want to take it first, or
you can go first, please.
Okay. Having done extensive research in Canada on this, the real challenge is, really beginning to deal with race, and then being able to be good with some of the history of Canada, right? Just like we in the United States, we share that history of being on stolen land, built out by slaves or people who are enslaved, and then taking of land in these issues. So government has to, in some cases, rematriate. And rematriation and reparation is in, to make this right, you've got to do what's right. And so it's going to be working with tribal governments. It's going to be, really going to those areas that are disenfranchised and giving them financial, help, as well as, making more connections with, and I would say people in the East, because we do a lot of, Denmark, we do a lot of Sweden, we do a lot of other countries. I would say we really need to build that relationship and let those folks be able to figure it out in the way that they see fit, which is very hard for our colonial way of looking at things. And in Canada, it's the government, Trudeau has said many times that, repatriation and giving patronage to the words, but really then being able to give the actions. So having dedicated revenue sources to tribes and underserved communities that have previously been disenfranchised. You start right there and you make that annual. And it's a budget, it's annual, and it's set to the inflation rate, which is something that is, people are like, oh, well, that's socialized. No, it's something that we have to do to make it right. And then we constantly keep up with where it is without putting a lens on it. So it's not like a set of funding that is restricted so heavily, but having those folks make a decision for themselves.
The only thing I would add really quickly is I think Canada does a bad job in terms of race when it compares itself to the United States. I think what Canada does is use the United States as a scapegoat to not have conversations that are rooted in race. I think they tend to, unfortunately, act as if they live in as if race doesn't exist. And to that point, racism doesn't even exist to the degree that it should. So I think staring in the mirror and coming to grips with your own structural and systemic racism that is there will be the first step. Secondly, I think it's important to, once you acknowledge it, the media does a bad job speaking about race through an episodic lens as opposed to a thematic one. These random acts of violence against persons of color in Canada aren't as random as they seem. On the ground, many people feel the pressures of systemic and structural racism there, but the news media does, in this particular case, a really bad job at pointing out how thematic that is, not just in a province, but across multiple provinces there. And so I think if we can get you to come to grips with that, yes, racism is real. It may not to you be the same as in America, but the people that are witnessing it and are feeling it there can't tell a difference. And so I think it starts there.
Thank you so much for those excellent responses. I really appreciate your insights. I believe that's it for questions. I don't see any more in the chat, but if anyone has any additional questions, please drop them in, and then we will work to connect the questions with our speakers and address them at another time. Carla, David, and Charles, I extend my sincere gratitude to each of you for your wonderful presentation and amazing insights. Your presentations have truly enriched our speaker series, and it has been a great pleasure to meet each of you. I will turn it over to Shireen now for some closing remarks.
Thanks, Sonia. I would like to echo what Sonia mentioned, like Charles, David, and Carla. This was very, very insightful presentation that I personally benefited from. You touched upon very important points that are very relevant to the era we're living in currently, related to mobility and equity, that I'm sure all the attendees have benefited, especially from your recommendation and key takeaways. So thank you very much, and thanks everyone for participating in this session. I would like to quickly announce about the next session in our speaker series that will be in June 22nd. It will be focused on resilient transit and resilient communities. So it will be at 12 p.m. as usual, Eastern time. So we're looking forward to a very great session and engaging session and your participation. And please feel free to share within your network. And last but not least, I would love to thank Sonia for her great contribution and for accepting to again moderate this session and great facilitation throughout the session. Thanks everyone, and see you next session.